I would like to emphasize that there is a need of tobacco cessation specialist who is quite competent in this country. There is a need of an hour. You require a competent tobacco cessation specialist who will help you tide over the crisis, who is going to help you prevent relapse. So the first and the foremost thing is to have a regular follow-up with tobacco cessation specialist. He is going to give you a pharmacotherapy. He is going to give you a behavioral counseling methods. These methods have to be followed diligently. This pharmacotherapy has to be followed diligently. You have to visit him to understand what are the roadblocks. Let him understand what are the roadblocks, what are the triggers, what are the cues which are triggering a relapse. A slip is not a failure. Slip is just a setback. What is slip that I'm talking about? Slip means if I was smoking about 30 cigarettes per day, but if I smoke only one cigarette intermittently, that is called slip. That is not the failure. So the idea is not to be depressed in our fight for tobacco cessation against tobacco, but to take slips in our stride and try and work out on those triggers as well. Now, requirement of a quit buddy, your partner who is going to stay with your life, with whom you are going to confide everything, is must. This quit buddy has a most important role in tobacco cessation. He or she has to help his or her partner at every step. The tobacco addict, I would say a patient, has to communicate very well with the quit buddy for all the triggers. Speak to him. We have various methods as to how to tide over the crisis, as to tide over the triggers. You have to practice the methodology where you have say delay, the technique of delay, deep breathing, exercise, drinking water, drugs, and so forth. This all have diet, very important. This all have to be followed diligently, because most often the relapse will happen after say a period of 3 to 4 months. So at that time you have to be very careful. You have to do away with whatever triggers. You have to maintain that particular regimen. There and there itself you will be able to quit the tobacco, prevent relapse. Most important thing is not just the motivation or the commitment that you should have, but the change in the environment. The persistent change in the environment is most important, which is very much important, because that is going to prevent the paralysis, the stroke, the cancer at various parts, the GI disturbances, so forth and so on. And that's why tobacco, I would again re-emphasize, is a knife which cuts the life. Thank you.